Alright, so today we're going to be doing a quick general survey on my patient. My patient is Sydney Paulson. So Sydney, can you just confirm with me your age?
I'm 24.
Perfect. So my client is exactly how she says she is. And so can you tell me where we are right now?
We are so normally
Yes.
Movement. I'm going to be holding
What
on the side.
what month is it?
It is October.
October, perfect. Do you know the date?
No, the 29th.
28th. Yeah. Okay, so I would say that she's her level of consciousness is good. She was able to have her identifiers, so she's A+3. Is that what it is? Yeah. Okay. And her skin color is just like a nice pink. It is appropriate for her race. And so can you just tell me a little bit about what you've ate today?
Perfect.
I did not have any breakfast. Then I had a chocolate chip cookie, and then I had salad for lunch with a piece of pizza.
So get you close your eyes. I'm going to place an object in your hand.
Okay, so is this kind of like a normal meal day for you?
Yeah.
Okay, so her nutritional status is pretty good. Like, she's getting some vegetables in. Maybe a chocolate chip cookie before lunch isn't ideal, but she's getting veggies, so this is good. And so her posture and position is appropriate for what we're doing. She's sitting up nice and straight. She's not hunched over or anything. I don't notice any obvious deformalities on her. Everything appears to be very symmetrical and normal for somebody her age and her size. And so also as well, I noticed that her facial expression is appropriate for being in a hospital clinical setting. It's just kind of, it's appropriate. It matches with her mood, and in the way that she's speaking to me, I can tell that she has good articulation and her pattern is good. She doesn't have any slurring or inability to talk, and she's answering all of my questions, so I know that she can hear me. And so then, Sydney, can you just tell me a little bit about your personal hygiene as well?
I shower either every day or every other day. I moisturize. I wash my hands every time I go to the bathroom and when I feel like I need to.
Okay. Yeah, no, that's perfect. So her personal hygiene is good as well. And then I'm just going to get you to stand up, and I just need you to take a few walks for me. I just want to measure your gait. All right, so just take a few steps forwards, please. Alright, perfect. So there was nothing to be concerned about her gait. She took one step, her foot followed, and her arms did swing, so her gait was good. She doesn't have any mobility devices that she uses. She's freely mobile. Yeah, that's good. Alright, so Sydney, we're just going to take some vitals for you. Upon coming into the bedside, we did already do her height and weight. So her height is 5'9", and her weight is 173 pounds. So this is completely appropriate for her body size and her height. There's no concerns there. So we're just going to take your blood pressure here, Sydney.
So I'm supporting your foot in dorsiflexion. Bring foot in dorsiflexion. And then her foot.
Oh boy. Alright. There we go.
Good. So then the last one, we test like but she's an adult, she shouldn't have it. That's you're just like try would be rolling up a baby would wear her toes out, but she shouldn't. So she should not have a Babinski, which she does not. Okay.
Alright, so her temperature is 36.6, so that is perfect.
Okay, what did we do last time when I was sitting and my foot was like a cross?
Yeah, that was setting up for that one,
That's
yeah.
why I looked at you funny, because I was like, why is she doing it backwards?
No, but it works.
I was like, why is she doing that?
And we have an SpO2 of 99. Again, perfect. And her pulse is... Where would your beats go?
It was 80.
no, 77. Her pulse was 77, and her blood pressure is 139 over 81. Now, is that normally normal for you?
No, it's normally more 120.
Okay, so it is a little high, but you know, she's in a hospital setting. It could just be a little bit anxious, but other than that, there's no concerns. Sydney, now, are you in any pain at all? Like
No pain.
No pain. All right. And so then we'll just take your blood pressure on your other arm. So on her right arm, we were 139 over 81, and then we'll just do her left. Alright, so on her left arm, we're 122 over 76. This is more normal for Sydney, so just a little bit of deviation between the two. 122 over 76. Perfect. And I did count her respirations while we waited for the blood pressure machine to go. She had a respiration rate of 14 breaths per minute. They were an appropriate depth. She wasn't, you know, struggling to get air in. And the rate was good. That's it. Okay, so we're just gonna do some range of motion on Sydney today. So, should we just, we need to make this look nice. There. Alright. Okay, so I'm just gonna do active range of motion on Sydney because I've noticed that she's completely able to move on her own, so there's no need for me to do this for her. She can do it on her own. So she's just gonna do a follow by follow with me. So we're gonna start with her head, so just look down to your chin. Perfect. Flexion. Up to normal. Extension and all the way back. Extension. Any pain? No? Okay. So can you just take your head to your shoulder? Back to normal. Other side. Good. Any pain? Okay. And rotate to the side. Back to the middle. Other side. Back to the middle. Any pain? Perfect. Okay. So now we're going to do your arms. So can you
should try and find it.
Go straight out. Any pain there? Okay. I'm just going to hold on to your shoulder while you do that. Again. Okay, I don't feel any cracking or crepitus, so we're good there. And then can you just go all the way back behind you? Any pain? No. Okay, and can you flex up?
No.
And down to extend. Any pain there? Okay, perfect. So now just hold your hands out. And we're going to do with your elbow, so pronation, and down for supination. Any pain there? Okay, perfect. For abduction, and towards you for adduction. Any pain there? No. Okay. So now can you just hold your arms like this and go up
And I will count
and down? Any pain? No. Okay. Perfect. Hold your arms out and rotate your palms upwards for supination, downwards for supination, pronation. Holy Jesus. Any pain there?
No.
Okay. So now we're gonna work on your wrist.
Okay.
Can you bend all the way down for flexion, back up for extension, and all the way hyperextension? Any pain? No? Okay, and spread your fingers out for abduction, together for adduction, and you can just wiggle them. Now can you touch your thumb to each finger? Position, any pain? No? Perfect. Alright, so that's good. Alright, so now I'm just going to test her muscle strength, see if there's any limitations with that. So Sydney, I'm just going to get you to push against me. Okay, and push against me here. Push against me here. Perfect. Push against me.
I'm not feeling any frills or
And push against me.
on her precordium, so
Yeah.
that's
Perfect. Now can you give me
I'm
your
going
hands?
to check for her
Push against me.
impulses now.
Perfect. Good. Okay, so I'm just going to be assessing Sydney's elbow here for any epitrochlear nodes. I shouldn't be feeling anything. So just give me a nice handshake here, Sydney. Perfect. Excellent. And then we're just going to go the other side. Excellent. I don't feel anything, so that's perfectly normal. Alright, so now I'm just going to auscultate Sydney's jugular vein here. So I'll just get her in a position. She's laying on her back with a pillow. And I'm just going to auscultate right here on her jugular vein.
Exhale for me and hold it. I didn't feel it, which is normal to not be able to feel on an adult like Morgan. Okay, so now I'm going to also take her heart, so please step.
Alright, so I don't hear any swishing or any weird noises. I just hear her pulse, her heart beating, and so that's perfectly normal. Alright, so now we're going to assess Sydney's abdomen. So first things first, I want to take a look at the contour and symmetry and look at her skin and see if I can see any abnormalities, any lesions, or anything unusual. So can you just please lift up your shirt? Perfect. Alright, so looking at it, it is very symmetrical. There's no masses or anything. I don't see any bumps. There's no bruises. She doesn't have any stretch marks. And so now, just looking at the contour, it's very flat. So everything looks good here. Alright, so now I'm just going to go ahead and auscultate. And so first, I'm just going to be listening with my diaphragm.
It's really hard to hear. But could you feel it? Feel it.
Alright, so there was no sounds noted upon doing auscultation for bowel sounds. It was crystal clear, there was not a sound to be had, so this is good. Now I'm just going to use my bell and I'm going to assess for vascular sounds. Alright, so I also did not hear any vascular sounds, which is also normal. We would not want to be hearing vascular sounds in her, so she's good for that as well. Alright, so now I'm just going to go ahead and I'm going to percuss on Sydney's abdomen, and I should not be hearing any dull noises. So yeah, I'm just going to go ahead.
Can you hear the sound?
I know that's what I mean. Like, it's a normal thing. So I'm just going to pretend to count for a minute this week.
Alright, so there was no dull noises, so that was good as well. And then now we're just going to go ahead and palpate. And so we're just checking for her abdomen muscles to be intact, and we don't want to have any lumps in here. We're going in a nice circular motion, just following the tracings of her bowels.
Really hard, I can hear it right there.
Do you have any pain when I do this?
Okay.
No pain? Alright, so I didn't feel any lumps in her. There was no pain upon palpating. And her abdominal muscles, they were good. They're strong. They're intact. There's no concerns there.
So I'm going to start the neurological exam on Kendra, and I'm just going to start by checking her pupils and how they constrict to light.
This wasn't up and over.
Yeah, up and
Okay.
Up and in.
But in, yeah.
Okay, so they both constrict equally and they are symmetrically fixed. So now I'm just going to do some. So would you close your eyes and tell me when you feel something on your face?
Now.
And then also
Now.
Okay, great. And so now would you keep your eyes closed and give me your hand and just tell me what I'm doing to your finger, like which direction?
Up. Side. Down. Other side.
Okay, great. Keep your eyes closed. I'm just going to place a small object into your hand and I'd like you to try to recognize it.
That's a coin.
Good. All right. So with your pointer finger, would you put it on your nose? Good. Now switch hands. Good. Okay. So I'm going to get you to lie down. And can you put your heel on your shin and try to slide it down? Good. And can you do that with your other leg? Good. Okay. Now you can sit back up because we're going to test some of your reflexes now. So we're going to test your bicep reflex. So just try to relax.
But I don't hear a pulse.
Okay, I'll hold my breath.
All right. Good. And now we will do your tricep. I'll do it on this arm. So keep it really relaxed.
I feel like I'm just like,
Full weight.
don't laugh.
There we go. Good. Now we're going to do your brachioradialis. So I can hold your thumbs. Then, so 2 centimeters above your radial. You feel that? Yeah. Okay. Great. And now I'm just going to test your patella. So I'm just going to down a bit. So. Did it go on camera?
Yeah.
Did it?
I barely just did it.
That was a good
That's a
one.
really good one.
Good one. Okay, great. Check her Achilles.
Say it again.
Now I'm just going to check her Achilles reflex. Good. So now I'm going to assess the circulation and pulses on Kendra for her lower extremities. Okay, so her legs look symmetrical, her skin is all even colored, I've assessed even warmth, and so her leg hair is evenly distributed, so I'm going to check her popliteal pulse. Okay, I can feel it, it's a bit weaker, but it is there. And so now I'm going to check her posterior tibial pulse. Okay, I can feel it. And I'm going to check her dorsalis pedis pulse. Okay, I can feel it. It's not very strong, but it is there. I'm going to check for edema. No edema. No. Returns quick. And her toes. Can you wiggle your toes? I'm just going to assess them for warmth, okay? Don't freak out. Okay, good. They have even warmth and they're good. So I'm going to do some range of motion on Kendra's lower extremities. So you let me know when you feel pain or anything like that. So first we're going to start with your hip. I'm going to bend it. Feel for any crepitance. So that's flexion, extension, and I'm going to do it again to feel your knee. No pain. There was a light crepitance in the knee and the hip, and so we're going to do some abduction and adduction, some circumduction. So then we're going to test for your strength. So can you push against my hands? Good. Push against the hands. Good. Push up. Good. Okay. So for her feet, I'm gonna tell her just how to move her feet because she has very ticklish feet. So could you inversion and eversion and try to hyperextend? There you go. Good job. And a little bit of circumduction there. And could you wiggle all your toes? Awesome. Okay. And so I'm going to test your feet strength. Could you push against me?
This is the posterior tibialis.
Good. Okay, so she was able to do all of that with any issues and only a little bit of minor crepitance in her hip and her knees. So I'm going to be doing a heart assessment on Kendra, so I'm going to start by just some light palpation and making sure I cannot feel any pulsations.
And test the muscle strength equally.
And no heaves are noted, so that is good. So I'm going to take a listen.
I almost forgot muscle strength on that.
Okay, so I'm going to note the second intercostal space. Alright, sounds good. Strong S1 and S2 sounds, and I'm just going to go down to the third space. It is a strong, steady rhythm, so I'm going to go down to the fourth space. Sorry, I'm just going to let it raw. So it is a good apical pulse. I can hear it strongly, so I'm going to take her apical pulse now.
Oh my god.
No, I'm just using the table.
I was like, we just need it. We just use it as a table.
No, I just have the nature patch slide.
But I forgot to do.
Alright, so your apical pulse was 61, and it was a strong and steady rhythm. So and now I'm going to listen with my bell to note if there's any S3 or S4 sounds.
And then I was like, but if we're moving it, because I read everything.
There we go. Wash it.
Take some more water. Take it off and then wash the area with some water. So
And then you rotate sides.
And then you make sure you fold it into each other, right?
And you rotate sides.
Yes.
I just said all that. I don't even know. I feel like she's more picky for the people redoing than doing shit.
Diminished reflux.
Well, I don't remember anything about silk, but I mean, I don't take care of myself. I was like, pass.
Okay, so there were no extra heart sounds noted. Alright, so now we're going to do a heart assessment on Sydney. I'm just going to take a listen at her heart. I'm going to also listen for abnormal sounds. There shouldn't be any as she's a healthy adult, and so we're just going to go ahead and get started. Alright, Sydney, so first I'm just going to check for any pulsations or heaves on the surface. And I don't feel any, so this is good. We don't want to feel that. So I'm gonna go ahead and listen. Alright, so starting with the second intercostal space.
strong. Just move down. Nice and strong.
Oh my gosh.
Perfect. And then we'll just go down here. Perfect. She's got a nice, strong apical pulse there. So now I'm just going to go ahead and I'm going to count it for a full minute. May I just borrow your watch? Alright, so her apical pulse was 63, so that's right in the normal range, and it was nice and strong. It had a very good rhythm to it, so there's no concerns there. So now I just want to use the bell of my stethoscope, and I'm going to listen for any abnormal heart sounds. We shouldn't be finding any as she is a healthy and adult, but that's how we would do it if there were, so we're just going to do a double check.
I mean, if we finish it, but then I'm trying to find where's the one where I was making you walk around. Video from that.
It's alright.
Doesn't show my feet.
Alright, and as I said before, there was no abnormal heart sounds, so Sydney is in good health today.